Hi, I'm Louie. I'm a behavior therapist with the dual diagnosis program at CAMH. Understanding challenging behavior allows us to approach assessment and treatment in an informed and systematic fashion. It may also reduce the stress experienced by clinicians and caregivers. It's important to think about behavior as the things that a person does that we can observe, things that we can see and hear. Behaviors are learned, they're influenced by environmental variables, and they're typically functional, meaning that they do serve a purpose for the individuals. We can think about maladaptive behavior as a skill deficit, that the individual may not have the appropriate alternatives to get the things that they're looking for as far as attention, tangible objects or items, or to escape unwanted interactions. So when that communication ability is missing, you'll often see increases in problem behavior. Talking about behavior is important, and communicating to clinicians effectively can really determine whether or not an assessment and intervention goes smoothly. You want to clearly describe what you see and hear when you're referring to behavior. Avoid inferences, judgments, or the reactions of others when describing behavior. One of the examples I'll usually give is, rather than saying Johnny was angry or Johnny was frustrated, I'd rather hear something like Johnny entered the kitchen, stomped his feet twice, and began humming loudly. This provides us with a way to talk about behavior where we both understand the exact details of what occurred, rather than me having to draw upon my ideas of what aggression or anger may be.
Okay, sounds good.
We can think about behavior occurring in 3 stages. You may have heard about the ABCs of behavior, and what that typically refers to is an antecedent, a behavior, and a consequence. When we talk about antecedents, we're talking about what's happening immediately before a behavior, such as the triggers or the events that signal that the behavior may be effective. This can be anything from the provision of a demand to that individual, the diversion of attention away from that person, or anything else that changes in the environment. A clear description of antecedents provides us with a lot of information around what could possibly be maintaining that behavior. When describing the behavior, again, it's very important to be as detailed and concise as possible. I want to know exactly what the person said or did, how many times it occurred, what the intensity was, and then the consequence, of course, being the outcome, what happened immediately after the behavior. This usually includes the reactions of others, any kind of change in the environment as far as the items that they're able to access, or things that were terminated as a result of that behavior, or social interactions that may have occurred as a result of the behavior. Stabilization is often a primary concern of caregivers. Having an individual who presents with very severe aggressive or self-injurious behavior can pose a significant stress for families. Reducing the intensity and difficulty of demands, making it easier for an individual to access items or activities, providing a very clear schedule, and providing frequent positive attention may be things that are easy fixes to reducing an individual's anxiety and the presentation of problem behavior. A useful tool in dealing with crisis and problem behavior is the development of an escalation continuum. Often individuals present with a hierarchy of problem behavior that gets more and more severe until they're completely unmanageable. Developing a crisis escalation continuum can help clinicians, ER staff, and other people who may be supporting the individual to understand the progression of the problem behavior. The first stage in any crisis is looking at how the person presents in baseline. What this means is how the individual presents most of the time when they're calm. This may include their typical self-stimulatory behavior like flapping or humming, pacing, social behavior, so how do they approach others, how do they ask for what they want, how do they say that they don't like something, and then the preferred activities that may occupy their time. The second stage of crisis development are identifying precursors. It's looking at how the behavior begins to build up on a hierarchy from least intense to most intense. It's the things that you know that something just isn't right. It typically includes a change or increase in behavior. It may present as humming or faster pacing than usual, and it's something that you often can tell that reliably precedes an episode of problem behavior. Outlining these things can be really useful for clinicians or staff in an ER or in safe beds or in other locations where the individual may need to be supported. Making a list of precursors can help people respond early and effectively. Okay. The next stage in the escalation continuum is clearly describing crisis behaviors. These are the behaviors that may pose a risk of harm to the individual or others. This can include aggression, self-injury, environmentally destructive behaviors. It's quite important to have a very clear indication of how these behaviors look, how they're typically targeted at others, and the effective responses to help reduce or manage those behaviors. The final stage in an escalation continuum may describe the de-escalation process. This is how the individual presents after a crisis. It's important here to clearly describe things that will keep the individual calm and that have been successful in the past at reducing their levels of agitation. So why collect all that data? When clinicians get involved with assessing challenging behavior, they often ask caregivers, staff, parents to collect a lot of different information. There may be tracking forms for how often the behavior occurs, what time it occurs, what happened before and after the behavior, and it can be a lot for caregivers to complete. It is very important, though, during an assessment to have a very objective and clear and detailed picture of what's going on. Clinicians may ask you to complete information on sleep, on presentation of pain, on environmental variables, who was there, what specifically occurred, and these help us make objective decisions when treating and assessing behaviors. Ideally, we want to approach treatment in a very informed and systematic fashion. This allows us not to run through trial and error approaches and look for the treatment that will likely be most effective for that individual the first time. Tracking the frequency of behavior can also be very important. Knowing how much the behavior is occurring and when can identify specific patterns, certain variables that may be influencing the behavior, and can tell you if treatments or specific approaches are working or not.